Hey there VC HHD students, my name's Andy, I'm a VC Health and Human Development teacher. In this short video we're going to look at answering the 2019 VC HHD exam question number 2. Before we dive into question number 2, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one will be coming out each day between now and the HHD exam at the end of the year. You can subscribe with the button in the corner of the video there. Please do so and let your HHD friends know too, so you can access all of the videos. You can also sign up to the ACE HHD exam preparation and revision sessions that I'm doing this year in September. You can book a spot to those at book.acevce.com. You can see our social media links there if you'd like to follow us and get access to alerts to the videos coming out each day. You can also email us if you've got any questions or if you've got any suggestions for videos you'd like me to work on. So you can see here question 2 in the 2019 exam was worth 4 marks, and it started with a piece of stimulus material, so a short case study on the Bush Classrooms project. So this was a bush clinic for Aboriginal men in Western Australia, which aimed to break down barriers to accessing hospital and healthcare. And so A for 2 marks was asking you to identify one principle of social model of health and explain how it's reflected in the Bush Classrooms project. So there's obviously 2 parts to that question, 1 mark allocated for your identifying and then 1 mark allocating for outlining how it's reflected in the Bush Classrooms project. And so there's different ways to remember the 5 principles of social model of health. You might have used the acronyms AREAS or IDEA. Okay, so you can see here that when you're identifying, the principles of social model of health, you need to make sure that essentially you get them word perfect. So the examiner's report mentioned that students who, rearranged some of the terms, in the actual principle or included words that weren't correct, such as addresses the broader dimensions of health instead of addresses the broader determinants of health, were unlikely to receive marks. So you need to make sure that you know those principles pretty much word perfect, and you can see there are examples of the other 4 principles there. And then after you identified the principle, it's a good idea just to identify it right at the start of your answer if you ask me. You then had to then link it to an aspect of the program. So you can see here this student chose acts to enable access to healthcare and then talked about how the Bush Classrooms project aimed to help Aboriginal men access modern health services by making healthcare more culturally appropriate to them. So obviously if it's more culturally appropriate, they're more likely to be able to engage in that healthcare service and access it. So that's a good example of one of those principles that was present in the project. Then B was asking you for 2 marks to provide 2 examples of how the health status of Indigenous people compares to health status of non-Indigenous people. Now, surprisingly, only 38% of the state was able to achieve full marks for this question. Making sure that with any of these questions, it's a comparison question, that you mention both groups in your answer. So you could have said that the life expectancy of Indigenous Australians is lower, than the life expectancy of non-Indigenous Australians, and that would have given you a mark. For your second example of health status, you could have talked about the maternal mortality rate of Indigenous people is higher than the maternal mortality rate of non-Indigenous people. So just making sure that you reference both, population groups in your answer. And so you can see down here that there was many different examples of health status you could have given, in your answer, but they made a note that rates of higher body mass index, represented a difference in a biological factor, not a difference in health status. So if you were talking about, something along the lines of body mass, you should be referring to obesity, and not body mass index. So that's just something to take note of in relation to health status. Okay, hopefully you found that video useful. As I mentioned, the Health Resource Hub YouTube channel is there, the ACE preparation sessions I'm running this year, our social media links, and our email. Thanks so much.